Assalamu alaikum wa rahmatullah. Welcome to our session today, which is about the management of urinary bladder injury. Today, we'll cover and continue our lecture about bladder trauma that we have started last week. Last week, we spoke about the causes, the presentation, and management of urinary bladder injury. Today, we will cover the management. Let me share my screen. So the screen is clear for you. If the screen is clear, Ruba, Dr. Ruba,
Yes,
is it
it is.
clear? Okay. So if you have a patient in ER or with a suspicion of urinary bladder injury, first you have to do a cystogram or CT cystogram to confirm your diagnosis and to classify your bladder injury either into intra or extraperitoneal bladder injury. And accordingly, you can proceed with your management either with surgical repair or catheter drainage. So, if you have diagnosed your patient with uncomplicated extraperitoneal bladder injury, all you need to do is urethral catheter drainage. So, you have to put your urinary catheter for 4 weeks at least, allowing your bladder to be healed, and subsequently you can remove the catheter. On the other hand, if your patient has been diagnosed with intraperitoneal bladder injury or complicated extraperitoneal bladder injury, that means the patient has extraperitoneal bladder injury and other associated injuries such as bladder neck injury, open pelvic fracture, or bone fragment projecting into the bladder, or rectal or vaginal injury associated with the bladder injury itself. In such cases, you need to proceed with open repair, that is surgical repair for that urinary bladder. Now I come to the end of my session today. Hope you enjoy. If you have any questions, now is the time. So far, no questions. Thank you so much. Just a reminder, please, you have a poll which contains 2 questions. You can proceed and answer the questions. I highly appreciate your participation. Thank you so much. So we have 2 questions. The first one, you have been called to review a patient with uncomplicated urinary bladder injury. What's your plan of management? So the first choice is surgical repair. The second one, watchful waiting. The third, urethral catheterization. The fourth option, exploratory laparotomy. So the correct answer is urethral catheterization, and 2 of you answered the question correctly. The second question, which of the following conditions needs surgical intervention? The first one is uncomplicated bladder injury. Second, extraperitoneal bladder injury, intraperitoneal bladder injury, and bladder contusion. The correct answer for this one is intraperitoneal bladder injury. Thank you so much for your participation. Hope you enjoy your weekends and see you next week. Thank you so much.